Hi, I'm Dr. Kurt Woeller for Integrative Medicine Academy. The title of this video is Catecholamine Neurotransmitter Conversions, Cofactors, and Converting Enzymes. So one of the things that we have in our Functional Medicine Clinical Rounds website, which is actually a membership website for healthcare practitioners, are these things called clinical data sheets. And these are PDF documents that you can download. We have a whole archive of these. And some profile lab markers, some are clinical pearl discussions, some are slides from various lectures that have clinical concepts. And this particular one is on this discussion of catecholamine neurotransmitters. So when we look at an organic acid test, and this is an example here of the neurotransmitter section of the organic acid test from Great Plains Lab. Now, this profile is broken down between phenylalanine and tyrosine metabolites and then tryptophan metabolites. There's obviously a lot of things that are happening here that are causing some of these markers to be high. In some cases, they can be low. And there's not just one factor involved. There can be multiple factors that are involved. And so you have to take time to sort of peel the layers back to try to understand some of the sequencing, the biochemistry, and some of the influences on these various neurochemicals. So here is a typical catecholamine neurotransmitter chart. And I want to just draw your attention to a few things. If we start with phenylalanine, okay, so phenylalanine becomes tyrosine, tyrosine becomes dopa. And dopa or L-dopa, there's a medication for that. Dopa becomes dopamine. All of these things are moving in those directions via converting enzymes. So pH is phenylalanine hydroxylase, TH is tyrosine hydroxylase, and DDC is dopa decarboxylase. Now, you'll notice that the dopa decarboxylase requires B6 as a cofactor. So a deficiency in B6 could compromise the ability to make dopamine. BH4, which is also called tetrahydrobiopterin, is a cofactor. You can actually take that as a medication or a supplement, is an important cofactor for phenylalanine hydroxylase and tyrosine hydroxylase. And so a deficiency here could compromise dopamine levels as well. So cofactor deficiencies of B6 and BH4 could lead to a decrease of dopamine production. Now, we could also increase dopamine production, for example, by increasing the intake of phenylalanine, tyrosine, along with some supportive B6. So those become precursors to dopamine production. At the level of dopamine, it's important to understand is that it can go in multiple directions. So one of the big areas it goes to is it moves towards norepinephrine. And norepinephrine is important within the nervous system for a stimulatory signaling, for example, in the sympathetic nervous system. It also gets converted to epinephrine for energy production. Now, the nutrient that helps that is S-adenosylmethionine. S-adenosylmethionine is called SAMe. It's part of the methylation system. And so a deficiency of SAMe could cause a deficiency of epinephrine production. Now, on the organic acid test, you'll have what's called vanillomidilic acid, which is representative of norepinephrine and epinephrine production. So a decreased VMA is telling us that we've got some issue either at the norepinephrine and or the epinephrine level. This pathway over here is very important. You can almost consider this to be a pressure valve for dopamine. We don't want too much dopamine building up because it can be toxic in the brain and nervous system. Now, dopamine gets converted to norepinephrine through an enzyme called dopamine beta hydroxylase. And that enzyme requires copper and vitamin C to be active. There are various things that inhibit dopamine beta hydroxylase, including Clostridia bacterial toxins, for example, that get picked up on the organic acid test. But a deficiency in copper and or a deficiency in vitamin C could also compromise that enzyme. Now, there is going to be some spillover of dopamine into the DOPAC HVA pathway. That just happens naturally. But many times an increase of homovinylic acid can be representative of maybe a block at our dopamine beta hydroxylase level, for example. So an increased HVA is basically an indicator of increased dopamine. DOPAC and HVA show up on the organic acid test, and they can be elevated for many reasons as well. So simply, if we have an increase of dopamine, that causes our DOPAC to go high, it causes our homovinylic acid to go high. Now, if we took HVA out of the way and said, okay, what if its levels were normal, but the DOPAC was elevated? Well, that could simply occur because we've got a deficiency in SAMe, that same SAMe that is helping convert norepinephrine to epinephrine. The other thing that could be happening is a polymorphism, a genetic variant in the gene that controls catecholamine O-methyltransferase. And in most cases, it's a downregulatory genetic variant, which means the function of the enzyme is decreasing. So that's called a slow COMT. That would cause DOPAC to go high. But what happens if our COMT is upregulated? So it's a fast functioning catecholamine. Well, that can end up leading to either a normal or sometimes a low DOPAC because we're moving things very rapidly through these pathways. So when you're studying the organic acid test, particularly with regards to the neurotransmitter metabolite section, the test itself doesn't tell us what's going on. We have to spend time looking at the variables that are known to affect these pathways. You'll notice here that our HVA is high and our DOPAC is high. Well, that could simply be that we've got an inhibition of that dopamine beta hydroxylase, for example, that doesn't allow dopamine to be converted to norepinephrine. What's interesting, though, is that this individual's norepinephrine levels are actually elevated, which is an unusual combination, and primarily that occurs because of excess stress. Mental emotional stress can drive that because there are signaling pathways that come from the brain into the adrenal medulla that produces norepinephrine. Now, you'll also notice that DOPAC is high and HVA is high, as I mentioned before. Okay, and so that could occur, for example, if we had a block at that dopamine beta hydroxylase, but maybe also had a fast COMT. So we're moving things through very quickly. That could cause both of these things to elevate. In this particular person, it's likely occurring, although I'm not showing you the test, because of a block in the dopamine beta hydroxylase, that enzyme that converts dopamine to norepinephrine, that causes the dopamine levels to elevate, that causes our DOPAC and our HVA to go high. And that the elevation of the vanillomedillic acid, okay, is occurring somewhat in part because of a SAMe deficiency. But remember, when we're talking about norepinephrine, it converts to epinephrine, and our VMA is linked to both pathways. So we could have a bit of a blockage here because of a SAMe deficiency. That would also cause our DOPAC to go high, but that would also then cause our norepinephrine to elevate, causing an increase of vanillomedillic acid. And that certainly could occur because of a nutrient deficiency as well as an overstimulation of the adrenal medulla. So there's a lot to this. We're just going over a few things. So if you are a practitioner that is using the organic acid test in practice, and you would like to consult with us directly, myself, Dr. Woeller, and my partner, Dr. Tenkatela, encourage you to become members of the functionalmedicineClinicalRounds.com website. You can schedule one-on-one lab consults with us. We have a 24/7 forum you can post questions to, and we have a lot of educational material in this website as well, including these functional medicine clinical rounds data sheets, these one-page PDF documents I had mentioned previously. If you have any questions about our mastery courses through Integrative Medicine Academy, please go to integrativemedicineacademy.com, take a look at our course overview, or you can email us at integrativemedicineacademy@gmail.com. Again, I'm Dr. Kurt Woeller for Integrative Medicine Academy. Thank you.